James was 75 when his daughter noticed something unusual. Every evening, the moment he walked through the front door, he removed his shoes. Not because they were old, not because they were too tight when he bought them, because by the end of the day, his feet and ankles had become so swollen that the shoes no longer fit properly. His socks left deep rings in his skin, his ankles looked puffy, and every night, James stared at them and imagined the worst. He became convinced that his heart was failing, so he stopped taking his evening walks. He drank less water because he thought fluid was building up inside his body. He began sitting more, he worried more, and within a few weeks, he felt weaker, less confident, and more frightened than before. But the cause was not what he expected. It was one of the blood pressure medications he had been taking every morning. Not because the medicine was necessarily dangerous, not because it had damaged his heart, but because nobody had clearly explained one of its most common side effects. I am Dr. Arthur Vance, and if you take Amlodipine, Lisinopril, Losartan, or another medicine for high blood pressure, this conversation may help you understand symptoms that many older adults quietly experience without realizing where they come from. Blood pressure medicines save lives. They reduce the risk of stroke. They protect the heart. They help protect the kidneys. They lower the chance of serious complications that can develop after years of uncontrolled pressure. But like every medicine, they can also cause side effects. Some are mild, some are uncomfortable, and a few require immediate medical attention. The key is knowing the difference, because fear can make people stop a medicine that is protecting them, and lack of awareness can make people ignore a warning sign that deserves urgent help. Today, I want to show you what the most common blood pressure medicines can do, why those effects happen, which symptoms should lead to a phone call, and which symptoms mean you should seek emergency care. But first, if you are over 60 and you want clear health information explained without fear, confusion, or complicated medical language, hit the subscribe button now. This channel is here to help you recognize important symptoms early and ask better questions before a small problem becomes a serious one. Now let us begin with amlodipine. Amlodipine belongs to a group of medicines called calcium channel blockers. Its job is to relax the muscle in the walls of your arteries. When those arteries relax and widen, blood flows more easily. That reduces the pressure your heart has to push against. For many people, amlodipine works extremely well, but there is one side effect that surprises many older adults: swollen ankles. You may notice that your feet look normal in the morning. Then, by late afternoon, your shoes feel tight. Your socks leave deep marks. The skin around the ankles looks puffy. Sometimes one side appears slightly worse than the other, although medication-related swelling usually affects both. Many people immediately assume they are retaining fluid because of heart failure, but amlodipine swelling works differently. The medicine relaxes the small arteries that carry blood into the tissues. However, the small veins that carry blood away do not widen to the same degree. That creates extra pressure inside the tiny blood vessels, especially in the lower legs where gravity is already pulling fluid downward. Some fluid then leaks into the surrounding tissue. That is why the ankles swell. This type of swelling does not always mean the heart or kidneys are failing, but it still deserves attention. Now, here is what you should not do. Do not stop amlodipine suddenly without speaking to your doctor. Do not take extra water pills on your own. And do not stop drinking water because you assume hydration is making the swelling worse. Dehydration can create a different set of problems, including dizziness, kidney stress, and dangerously low blood pressure. Instead, tell your doctor when the swelling began. Did it start after the medicine was added? Did it worsen after the dose increased? Does it improve overnight? Is it in both legs? Does it come with breathlessness? Those details matter. Sometimes the dose can be reduced. Sometimes another medicine can be added or substituted. Sometimes leg elevation or compression stockings may help. But compression stockings are not right for everyone, especially if circulation in the arteries is poor, so ask before using them. Now, there is an important difference between mild medication-related ankle swelling and swelling that may signal something more serious. If one leg suddenly becomes much more swollen than the other, especially with pain, warmth, or redness, seek urgent medical evaluation. That can be a sign of a blood clot. If swelling comes with sudden shortness of breath, chest pain, coughing, or fainting, treat it as an emergency. If both legs are swelling and you are also gaining weight quickly, waking up breathless, or needing more pillows to sleep, contact your doctor promptly. That may point toward heart failure or fluid buildup. The medicine may not be the whole story. Now let us move to Lisinopril. Lisinopril belongs to a group called ACE inhibitors. These medicines block a chemical pathway that tightens blood vessels and encourages the body to hold on to salt and water. By blocking that pathway, Lisinopril helps blood vessels relax and lowers pressure. It can also help protect the heart and kidneys in certain patients. But Lisinopril is famous for one very specific side effect: a dry cough, not a wet cough. Not a cough with mucus, not the kind that usually comes with fever. This cough often feels like a constant tickle in the throat. You may keep clearing your throat, you may cough more at night. You may feel as if something is stuck, even though nothing comes up. And what makes it confusing is that the cough may not begin on the first day. It may start several weeks later, sometimes even months later. By then, people blame allergies, dust, cold weather, reflux, dry air, or age. One older woman I met spent months buying cough drops, humidifiers, and allergy medicine. She had chest tests. She changed her bedding. She stopped drinking cold water. But nobody had asked when the cough started in relation to her blood pressure medicine. Once her doctor changed the medication, the cough gradually improved. Now, this does not mean every cough on Lisinopril comes from the medicine. A cough can also come from infection, asthma, reflux, lung disease, heart failure, or other causes. So, do not diagnose yourself. But if you develop a persistent dry cough after starting Lisinopril, mention it. Your doctor may choose a different type of medicine, often from a group called angiotensin receptor blockers. Losartan is one example. Now, Lisinopril also has a rare but serious side effect that every patient should know: sudden swelling of the lips, tongue, face, or throat. This is called angioedema. It can make swallowing or breathing difficult. It may happen soon after starting the medicine, but it can also happen after someone has taken it for a long time without any previous problem. If your lips, tongue, throat, or face suddenly swell, do not wait to see whether it improves. Do not drive yourself if breathing is difficult. Call emergency services. That reaction can become life-threatening quickly. This is one of the most important warning signs in the entire video. Now, if this kind of practical medication guidance is useful to you, subscribe to the channel. Many older adults take the same pills for years without anyone clearly explaining what to watch for. Subscribing helps you stay informed about the medicines, symptoms, and daily habits that matter most after 60. Now let us talk about Losartan. Losartan belongs to a group called angiotensin receptor blockers. It lowers blood pressure through a pathway similar to Lisinopril, but it usually does not cause the same dry cough. That is why people who develop a cough on Lisinopril are sometimes switched to Losartan. But Losartan has its own concerns. One of the most important is potassium. Potassium is essential. Your nerves need it. Your muscles need it. Your heart depends on the right balance of it. But too much potassium in the blood can become dangerous. Losartan can raise potassium, especially in people with reduced kidney function, diabetes, dehydration, or those taking certain other medicines. Now, many people accidentally increase potassium without realizing it. One common source is salt substitute. Products labeled low sodium salt often replace sodium with potassium chloride. A person trying to protect their blood pressure may begin adding this substitute to every meal. But if they are also taking Losartan, Lisinopril, spironolactone, or another medicine that raises potassium, the combination may push potassium too high. High potassium does not always create obvious symptoms. Some people feel weak. Some feel unusually tired. Some develop muscle heaviness. Some feel palpitations or an irregular heartbeat. And some feel nothing at all. That is why blood tests matter. When your doctor checks kidney function and electrolytes, it is not meaningless paperwork. Those tests help confirm that the medicine is still safe for your body. Now, do not stop eating all foods that contain potassium unless your doctor tells you to. Potassium is present in many healthy foods. The issue is balance. People with normal kidneys may handle dietary potassium well. People with reduced kidney function may need more careful guidance. And potassium supplements or salt substitutes can create a much larger problem than normal food. Always tell your doctor about every supplement and every salt substitute you use. Now let us talk about dehydration. This is where a medicine that has been stable for years can suddenly behave differently. Imagine you develop vomiting or diarrhea, or you have a fever and cannot drink, or there is a heat wave and you sweat heavily. Your medication has not changed, but your body has. You now have less fluid circulating in your bloodstream. That can make blood pressure fall more than expected. You may feel dizzy, weak, confused, unsteady. You may faint. And certain blood pressure medicines can place more stress on the kidneys when dehydration is severe. This is why every older adult taking blood pressure medicine should ask one simple question during a routine visit. What should I do with my medication if I become very dehydrated, have repeated vomiting or diarrhea, or cannot keep fluids down? Do not create your own rule. Different medicines require different instructions. Some people may be told to pause certain medicines temporarily during severe illness. Others may need a different plan. The safest time to ask is before the illness happens. Write the instructions down, keep them with your medication list, and make sure a family member knows the plan. Now let us discuss pain medicines. Many older adults take ibuprofen or naproxen for arthritis, back pain, or joint pain. Because these medicines are sold without a prescription, people often assume they are harmless, but they can affect the kidneys. They may also raise blood pressure. And when they are combined with medicines such as Lisinopril, Losartan, or water tablets, especially during dehydration, kidney stress can increase. This combination can sometimes create what doctors call a triple threat to the kidneys: a medicine that changes kidney blood flow, a water pill that lowers circulating fluid, and an anti-inflammatory pain reliever that further reduces blood flow through the kidneys. That does not mean nobody can ever use ibuprofen or naproxen. It means regular use should be discussed with a doctor. Ask whether acetaminophen, topical treatments, physical therapy, heat, or another option would be safer for your situation. And always read the labels of cold and flu medicines, because some contain anti-inflammatory ingredients or decongestants that can raise blood pressure. Now let us talk about dizziness when standing. You sit in a chair for an hour, then you stand. The room shifts. Your vision darkens. You reach for the table. A few seconds later, it passes. Many people say, "I just stood up too quickly." Sometimes that is true, but frequent dizziness after standing may be a sign that blood pressure is dropping too much. This is called orthostatic hypotension. Blood pressure medicines can contribute, especially when combined with dehydration, heat, illness, alcohol, or other medications. This matters because dizziness after 70 is not just uncomfortable. It can cause a fall, and a fall can lead to a broken hip, wrist fracture, head injury, fear of walking, and loss of independence. If you feel dizzy when standing, do 3 things. First, rise slowly. Sit on the edge of the bed for a moment before standing. Second, hold something stable. Do not begin walking until you feel steady. Third, tell your doctor if it happens repeatedly. Your seated blood pressure may look perfect while your standing pressure falls too low. Ask whether your pressure should be checked lying down, sitting, and standing. Sometimes the dose or timing of medication needs review. Sometimes hydration needs attention. Sometimes anemia, heart rhythm problems, nerve disease, or another cause is involved. Do not simply accept repeated dizziness as aging. Now, some blood pressure medicines are water tablets, also called diuretics. Common examples include hydrochlorothiazide, chlorthalidone, and furosemide. These medicines help the body remove extra sodium and water through urine. They can be very useful, but they may also cause more frequent urination, dehydration, low sodium, low potassium, or gout in some people. If you take a water pill and feel unusually weak, confused, cramped, dizzy, or thirsty, mention it. If you are urinating so often that you stop drinking, that can create a dangerous cycle. Many people take water pills in the morning to reduce nighttime bathroom trips, but follow the schedule your doctor gives you. Do not move the dose on your own. And do not double it because your ankles look swollen unless you have been specifically instructed to do so. Now, there is another medication group called beta blockers. Examples include metoprolol, atenolol, and carvedilol. These medicines slow the heart rate and reduce the force of contraction. They may be used for high blood pressure, heart failure, chest pain, or irregular rhythms. Common side effects can include fatigue, cold hands and feet, dizziness, and a slower pulse. Some people feel as if their energy disappeared after starting one, but fatigue has many causes, so do not automatically blame the medicine. Check your pulse. Notice when the fatigue began. Ask whether the dose may be too strong, and never stop a beta blocker suddenly without medical guidance. Sudden withdrawal can cause the heart rate and blood pressure to rise sharply. It can also trigger chest pain or heart rhythm problems in certain people. This is why medication changes must be planned. Now, if you are learning something you wish someone had explained when your prescription was first given, hit the subscribe button. This channel exists because older adults deserve more than a list of instructions. You deserve to understand what your medicine is doing and what your body may be trying to tell you. Now let us discuss home blood pressure readings. Many people become frightened by one high number or one low number. They see 160/90 and panic. Or they see 105/60 and skip the next dose. But one reading does not always tell the whole story. Blood pressure changes throughout the day. Pain can raise it. Stress can raise it. Talking can raise it. A full bladder can raise it. Poor sleep can raise it. Recent exercise, caffeine, or smoking can change it. And incorrect technique can create misleading numbers. To get a more useful reading, sit quietly for 5 minutes. Keep both feet flat on the floor. Support your back. Rest your arm at heart level. Do not talk. Use the correct cuff size. Take 2 readings about 1 minute apart. Then record the average. Try to measure at roughly the same times each day. Doctors make better decisions from patterns than from isolated numbers. Bring a written log to appointments. Also write down symptoms. For example, dizzy at 8 in the morning after medication, or headache before evening dose, or ankle swelling worse after 5 in the afternoon. That information can be more useful than the number alone. Now, what should you do if you miss a dose? Do not automatically double the next one. The correct response depends on the medicine and how much time has passed. Check the instructions from your pharmacist or doctor. If you are unsure, call the pharmacy. Doubling some blood pressure medicines can cause a dangerous drop. Skipping repeatedly can allow pressure to remain uncontrolled. The goal is consistency. Take the medication at the same time each day when possible. Use a pill organizer. Set an alarm. Keep a written chart. Ask a family member for support if remembering has become difficult. Medication works only if it is taken as prescribed. Now let me tell you what happened with James. His daughter convinced him to call his doctor. His heart and kidneys were evaluated. The swelling was not from heart failure. It was strongly connected to the dose of amlodipine he had recently started. His doctor adjusted the treatment plan. James began elevating his legs in the afternoon. He returned to gentle walking. He stopped restricting water unnecessarily, and over time, the swelling improved. But the most important change was not in his ankles. It was in his confidence. He no longer looked at every symptom and imagined the worst. He understood what the medicine was doing, and he knew when to call for help. That is what safe medication use looks like. Not fear, not blind trust. Understanding. Now let us review the symptoms that require urgent attention. Sudden swelling of the lips, tongue, throat, or face while taking lisinopril or a similar medicine is an emergency. Chest pain, severe shortness of breath, fainting, or signs of stroke are emergencies. A very slow heart rate with weakness or fainting needs urgent evaluation. One-sided leg swelling with pain or warmth needs prompt medical attention. Severe weakness, confusion, or an irregular heartbeat may be related to electrolyte problems and should not be ignored. Very low blood pressure with fainting, cold clammy skin, or confusion needs urgent help, and severe vomiting or diarrhea while taking blood pressure medicine deserves a call for medical guidance, especially if you cannot keep fluids down. Now, which symptoms usually deserve a routine phone call rather than emergency care? Persistent ankle swelling, a dry cough that will not go away, frequent dizziness on standing, new fatigue after starting or increasing a dose, muscle cramps, changes in urination, repeated low readings, repeated high readings despite taking medication, or side effects that make you want to stop the medicine. Call before stopping. There is almost always a safer way to adjust the plan. Now, prepare for your next appointment with 4 questions. First, what type of blood pressure medicine am I taking, and how does it work? Second, which side effects are common with this medicine? Third, which symptoms mean I should call you and which mean I should seek emergency care? Fourth, what should I do during dehydration, vomiting, diarrhea, or very hot weather? Also ask when your kidney function and electrolytes should be checked. Ask whether your home monitor is accurate. Ask whether your blood pressure should be checked while standing. And ask whether any over-the-counter pain medicines, cold medicines, supplements, or salt substitutes interact with your treatment. These questions do not make you difficult. They make you safer. Now, I want to address one final mistake. Some people stop taking medication because their blood pressure becomes normal. But often, the number is normal because the medicine is working. Stopping it may allow pressure to rise again. Other people take an extra tablet after one high reading. That can cause pressure to fall too far later. Do not chase every number with a pill. Follow the plan your doctor gave you. And if the plan no longer fits your symptoms, ask for a review. Your body changes with age. Kidney function changes, weight changes, other medications are added, illness happens. A dose that was right 2 years ago may need adjustment today. Regular medication review is part of good care. It does not mean the original treatment was wrong. It means your treatment must keep up with your body. Now, before we close, subscribe to the channel if you want more senior health guidance that helps you use medications safely, recognize warning signs early, and protect your heart, brain, kidneys, balance, and independence. Many of the most important health problems after 60 begin quietly, and the next video may help you notice something before it becomes serious. I am Dr. Arthur Vance, and I want you to remember this. Blood pressure medicine is not something to fear. It is a tool, and powerful tools work best when you understand them. Know the name of your medicine. Know why you take it. Know the common side effects. Know the dangerous warning signs. Know what other medicines and supplements can interact with it, and never be afraid to ask questions, because the safer you feel with your treatment, the more likely you are to take it correctly. And when blood pressure is controlled safely, you are protecting your heart, your brain, your kidneys, your eyesight, and your independence. Everything shared here is for general education only and does not replace personal medical advice. Do not stop, start, double, or change blood pressure medication without speaking to your doctor or pharmacist. If you develop chest pain, severe shortness of breath, fainting, stroke symptoms, or swelling of the lips, tongue, face, or throat, seek emergency medical care immediately.